I uploaded my last 3 medical bills to an AI tool and it flagged over $4,000 in charges that shouldn't have been there. Turns out this isn't some rare glitch. 1 in 4 Americans gets overcharged by hospitals every year. And most of them never catch it. Welcome to the scripted future. Here's the thing about medical bills. They're deliberately complicated. Hospitals know most people won't sit down with a highlighter and manually audit every line item. So errors slip through. Duplicate charges. Services you never got. Inflated procedure codes. The American Hospital Association estimates billing mistakes cost patients billions annually, and AI is quietly becoming the best tool to catch them before you pay. I decided to test this myself. I grabbed my last 3 hospital visits, uploaded the bills to ChatGPT and also tried a specialized tool called Dr. Thorne, which is built specifically to audit medical charges. The results were wild. On a $2,000 emergency room visit, the AI flagged a charging code that appeared twice. Same procedure, same date, slightly different wording. On another bill from urgent care, it caught a charge for a test that wasn't listed in my discharge papers. That alone was $650. By the time I'd run all 3 bills through the system, the AI had identified around $4,200 in questionable charges. I contacted the billing department at one hospital. They investigated. 2 weeks later they issued a credit. 1 overcharge confirmed. Let me break down why this actually works. First, medical billing codes are a language almost nobody speaks fluently. There are over 70,000 of them in the ICD system, which hospitals use to bill insurance companies. That's 70,000 ways to describe what happened to your body in medical terms. A human auditing their own bill is basically trying to spot an error in a foreign language document they got once. An AI, though, can scan the entire document instantly, cross-reference standard billing patterns, flag deviations, and catch what's out of place. It's not magic. It's just pattern recognition at scale. Second, this is happening right now and it's free. ChatGPT's free tier can handle medical bill uploads. You don't need to buy anything or sign up for some weird service. Just paste the text or upload an image of the charge breakdown. Then ask it to look for common billing errors, duplicate charges, and codes that don't match your discharge papers. Competitors like PatientFi and Galileo Health are also building this into their platforms, and some insurance companies are starting to offer it as a benefit. But the honest truth is you can start today with tools you already have. Third, the scale of the problem is still massive. The Medical Billing Advocates of America estimates that between 30 and 40% of all medical bills contain some kind of error. Most are honest mistakes. System glitches. Staff typos. But some are intentional overbilling, especially from big hospital systems that know collections teams are aggressive and most patients won't push back. The Commonwealth Fund found that people aged 25 to 34 are hit hardest because they're less likely to have had long-term relationships with the same provider, so they don't know what normal charges should be. In other words, this demographic is getting overcharged more often and has fewer tools to fight back. Until now. There is a catch. AI isn't a lawyer. It can flag something suspicious, but you still have to do the follow-up work. Call the hospital. Ask about the charge. Get it in writing. Sometimes they'll admit it's an error. Sometimes they'll explain why it's legitimate. The AI gets you from 0 to curious in 30 seconds. After that, you're still responsible for the conversation. That's not a flaw. That's just how this actually works. The bigger picture here is that Gen Z and millennials grew up in a world where healthcare costs more than it did for their parents. The average person now carries medical debt. Finding these errors isn't some optional productivity hack. It's practical money recovery that most people leave on the table because they assume hospital bills are correct. They're not. Not always. So here's my question for you. Have you ever actually audited a medical bill line by line? Or do you just pay it? Tell me in the comments whether you found errors yourself, or if you're going to try this with your next bill. Either way, let us know what happens. Subscribe to the Scripted Future for more ways AI is changing how regular people save time and money. If you enjoyed this, subscribe to the Scripted Future for more tech and AI news that actually matters.